In July of 2021, Dr. Nant and colleagues from the Austrian Breast Cancer Study Group published an article in the New England Journal exploring and discussing their findings about the optimal duration of adjuvant endocrine therapy in postmenopausal women. And in their study, they determined that 7 years of treatment was sufficient and that 10 years of therapy was probably excessive treatment for most women. It's interesting. Yes, in that study, they demonstrated that an additional 2 years, meaning a total of 5 years of therapy, is sufficient compared to doing 10 years. But they used no biomarker test in that study to determine if the women would benefit or not at all. Also in that study, statements were made that with additional hormonal therapy, endocrine therapy, especially aromatase inhibitors, we start to accumulate toxicities or negative side effects of those drugs that in some instances eclipse any benefit that a woman is going to achieve in preventing her breast cancer recurrence. So in my read of that article, really, that article isn't going to change how I use the breast cancer index. For my patients that have low-risk disease to begin with and are approaching 5 years of treatment, I would still get that test because there's an excellent likelihood that they will be in that group that is not going to benefit at all. And therefore, they can be spared the negative side effects of the drug. And from the IDEAL study, we know that if you're going to benefit, the duration of time that really is optimal is not 7 or 7.5 years, it's 10 years. So even with this article published in the New England Journal, I think it really doesn't change my thinking that much about getting a breast cancer index test. As a matter of fact, it makes a stronger case that everyone should get a breast cancer index if they're thinking about extending endocrine therapy at all, because it may sort out women who would have been given 2 additional years who really don't even need 2 additional years.